Absence seizure, also known as petit seizure, is a type of epilepsy that causes brief episodes of staring or unresponsiveness. It usually affects children and teenagers, but can also occur in adults. Absence seizure is often mistaken for daydreaming, inattention, or lack of focus, but it is actually a neurological condition that requires diagnosis and treatment. In this video, we will explain what absence seizure is, what causes it, how it is diagnosed, how it is treated, and how it affects daily life. I will also share some tips and resources for people living with absence seizure and their families. What is absence seizure? Absence seizure is a type of generalized seizure, which means it affects both sides of the brain at the same time. It usually lasts for a few seconds, up to 20 seconds, and then stops on its own. During an absence seizure, the person may appear to be staring blankly, blinking rapidly, or twitching slightly. They may not respond to verbal or physical cues, and they may not remember what happened during the seizure. They may resume their activity as if nothing happened, or they may feel confused or sleepy afterwards. Absence seizure can occur several times a day, or even hundreds of times a day, depending on the severity of the condition. It can interfere with learning, socializing, and safety, especially if the person is driving, swimming, or operating machinery. Absence seizure can also be a precursor to other types of seizures, such as tonic-clonic seizures, which cause loss of consciousness and convulsions. What causes absence seizure? The exact cause of absence seizure is not fully understood, but it is believed to be related to abnormal electrical activity in the brain. This can be triggered by genetic factors, developmental disorders, brain injuries, infections, or metabolic imbalances. Some people may have a family history of epilepsy, while others may have no known risk factors. Some common triggers for absence seizure include stress, lack of sleep, fever, flashing lights, hyperventilation, alcohol or drug use. However, not everyone with absence seizure has identifiable triggers, and some seizures may occur randomly or without warning. How is absence seizure diagnosed? Absence seizure can be difficult to diagnose because it can be confused with other conditions such as attention deficit hyperactivity disorder, autism, anxiety, or depression. It can also be overlooked by parents, teachers, or doctors who may not notice the subtle signs of the seizure or may attribute them to normal behavior. The first step to diagnose absence seizure is to consult a neurologist, a doctor who specializes in the brain and nervous system. The neurologist will ask about the person's medical history, family history, symptoms, and frequency of seizures. They will also perform a physical examination and some tests, such as electroencephalogram. This is a test that measures the electrical activity of the brain using electrodes attached to the scalp. It can detect the characteristic patterns of absence seizure, such as spike and wave discharges, which are bursts of high-frequency waves followed by low-frequency waves. The neurologist may also induce a seizure by asking the person to hyperventilate or expose them to flashing lights. Magnetic resonance imaging. This is a test that uses a strong magnetic field and radio waves to create detailed images of the brain. It can rule out other causes of seizures, such as tumors, cysts, strokes, or infections. Blood tests. These are tests that check for any abnormalities in the blood, such as glucose, electrolytes, hormones, or antibodies. They can also rule out other causes of seizures such as diabetes, thyroid disorders, or autoimmune diseases. The diagnosis of absence seizure is based on the combination of the person's history, symptoms, and test results. The neurologist may also classify the type of absence seizure, such as typical or atypical, depending on the duration, frequency, and features of the seizure. How is absence seizure treated? The main goal of treatment for absence seizure is to reduce or eliminate the seizures and improve the person's quality of life. The treatment options include medication. This is the most common and effective treatment for absence seizure. There are several types of anti-seizure drugs that can prevent or reduce the occurrence of seizures, such as ethosuximide, valproic acid, lamotrigine, or levetiracetam. The neurologist will prescribe the best medication for the person, based on their age, weight, type of seizure, and side effects. The person will need to take the medication regularly and follow the dosage instructions. They will also need to have regular blood tests to monitor the level of the medication and check for any adverse effects. Ketogenic diet. This is a special diet that is high in fat and low in carbohydrates. It can help some people with absence seizure, especially children, by changing the way the brain uses energy and reducing the electrical activity. The diet requires careful planning and supervision by a dietitian and a neurologist, and it may have some side effects such as nausea, constipation, or weight loss. Vagus nerve stimulation. This is a surgical procedure that involves implanting a small device under the skin of the chest. The device sends electrical impulses to the vagus nerve, which is a nerve that connects the brain to the body. The stimulation of the vagus nerve can reduce the frequency and severity of seizures, but it may not eliminate them completely. The device can be adjusted by the neurologist or the person using a magnet. The procedure may have some risks such as infection, bleeding, or voice changes. Responsive neurostimulation. This is a surgical procedure that involves implanting a small device in the skull. The device monitors the electrical activity of the brain and delivers stimulation to the areas that are involved in the seizure. The stimulation can stop or shorten the seizure, but it may not prevent it from happening. The device can be programmed by the neurologist or the person using a remote control. The procedure may have some risks, such as infection, bleeding, or headache. The treatment for absence seizure may vary from person to person, depending on the response, tolerance, and preference of the person. The neurologist will evaluate the effectiveness and safety of the treatment and make any necessary adjustments. The person will need to follow the treatment plan and report any changes or concerns to the neurologist. The person will also need to have regular follow-ups and tests to monitor the condition and the treatment. How does absence seizure affect daily life? Absence seizure can have a significant impact on the person's daily life, especially in terms of education, work, and social activities. The person may face some challenges, such as learning difficulties. The person may have trouble concentrating, remembering, or following instructions due to the frequent interruptions of the seizure. They may also miss important information or fall behind in their studies. They may need extra support or accommodations from their teachers, such as more time, notes, or tutoring. Work problems. The person may have difficulty performing their tasks, meeting deadlines, or communicating with their colleagues due to the disruption of the seizure. They may also face discrimination or stigma from their employers or coworkers. They may need to disclose their condition and request reasonable adjustments, such as flexible hours, breaks, or modified duties. Social issues. The person may have trouble maintaining relationships, participating in activities, or expressing themselves, due to the isolation or embarrassment of the seizure. They may also face misunderstanding or judgment from their friends or family. They may need to educate others about their condition and seek support from their loved ones or peers. Safety risks. The person may have an increased risk of injury, accident, or harm due to the loss of awareness or control during the seizure. They may also have a higher chance of developing other types of seizures, such as tonic-clonic seizures, which can be life-threatening. They may need to take precautions, such as wearing a medical alert bracelet, avoiding triggers, or having a seizure plan. Despite these challenges, the person can still lead a fulfilling and productive life with absence seizure, with the help of proper treatment, care, and support. The person can also benefit from some coping strategies, such as seeking professional help. The person can consult a neurologist, a psychologist, a counselor, or a therapist who can provide medical, emotional, or behavioral guidance and therapy. They can also join a support group, where they can share their experiences and learn from others who have similar conditions. Managing stress. The person can practice relaxation techniques, such as breathing, meditation, yoga or massage, which can help reduce stress and anxiety, which can trigger or worsen seizures. They can also engage in hobbies, interests, or passions, which can provide enjoyment and fulfillment. Maintaining a healthy lifestyle. The person can adopt a balanced diet, a regular exercise routine, and a good sleep hygiene, which can improve their physical and mental well-being and prevent or reduce seizures. They can also avoid or limit alcohol, caffeine, nicotine, or drugs, which can interfere with their medication or trigger seizures. Being positive. The person can focus on their strengths, achievements, and goals, rather than their limitations, challenges, or failures. They can also express gratitude, optimism, and hope, which can boost their self-esteem and confidence. Absence seizure is a type of epilepsy that causes brief episodes of staring or unresponsiveness. It can affect anyone, but it is more common in children and teenagers. It can be caused by various factors, such as genetics, brain disorders, or environmental triggers. It can be diagnosed by a neurologist who can perform a physical examination and some tests, such as electroencephalogram, magnetic resonance imaging, or blood tests. It can be treated by medication, ketogenic diet, vagus nerve stimulation, or responsive neurostimulation, which can prevent or reduce seizures and improve quality of life. It can affect daily life in terms of learning, work, social, and safety aspects, but it can be managed by proper care, support, and coping strategies. If you or someone you know has absence seizure, you are not alone. There are many resources and communities that can help you understand, cope, and live with this condition. Thank you for watching.